compassionately, I like to stress that this is not a substitute for professional, medical, or mental health services. If that is the case, please contact a professional immediately and seek assistance. However, outside of that, what I'd like to share with you is an incredible observation of an association between folic acid intake and the reduced risk of suicide attempts. Now, also, the caveat here is this. It is an association. What has to be conducted in the future is actually like randomized, controlled, double-blind, placebo-controlled studies, which can basically eliminate any other potential confounding meaning, for those not familiar, elements that can skew the results unintentionally. For example, folic acid intake could include a large group of pregnant women naturally take less suicide attempts, and that could confound the research or the outcome. And or, for example, we'll delve into that as well, healthy users, people taking vitamin supplements, may naturally increase or decrease the amount of suicide attempts because they're trying to improve positive behaviors. That's confounding, that can result in a dramatic outcome. However, though, the researcher's personal responsibility to try to eliminate that confounding on its own and take that into account, and still yet the results were pretty dramatic. They found out that the healthy user or pregnant women type confounding did not apply to the outcome here. But still, just the same, randomized, controlled, double-blind, crossover placebo study would be the gold standard to validate this information. With that all out of the way, now let's look, may I share with you an incredible association observation that was recently published in the Journal of American Medical Association Psychiatry edition. Here we go. You ready? The title is kind of long, but again, the researchers want to take the appropriate care as not to mislead anybody that may be reading the article casually. To proceed, study finds folic acid treatment is associated with decreased risk of suicide attempts. This study, published in Journal of American Medical Association Psychiatry on September 28th, used data from the health insurance claims of 866,586 patients and looked at the relationship between folic acid treatment and suicide attempts over a 2-year period. They found that patients who filled prescriptions for folic acid, also known as B9, experienced a 44% reduction in suicidal events, suicide attempts, and intentional self-harm. Now, the interesting part about this, too, we're not talking mood elevation, we're not talking anti-anxiety. All we're talking about is basically the association between folic acid intake, which will go in the amount that they referenced in the study through the abstract towards the end, but the association of that and the association here, nothing else. To proceed, a 44% reduction in suicidal events, according to the researchers. They're just hopeful that these findings can improve the suicide prevention efforts, especially because of how accessible folic acid is. Quoting Gibbons, "There are no real side effects. It doesn't cost a lot of money. You can get it without a prescription," Gibbons said. "This could potentially save tens of thousands of lives." Now you can see the sensitive nature of the outcome. And this is why, keep in mind, the folic acid had to be taken over time. So anybody, again, looking for immediate help now, contact the proper authorities' professional help. The confounding factors, to give you an idea on how they try to weed out anything else that could have basically corrupted the outcome in layman's terms. Proceed. Sometimes they're actually both related to confounding factor, such as socioeconomic status or health conscious attitudes, or because they're prescribed for a condition that is associated with suicide or depression. But Gibbons and his group were able to partially eliminate these complications by comparing subjects to themselves before and after being prescribed the drug, instead of comparing subjects who did and did not take the drug to one another. In fact, they initially thought folic acid had only shown up in their study because of a simple explanation, but that turned out not to be the case. Quote, When we first saw this result, we thought it was pregnancy. Pregnant women take folic acid, and pregnant women tend to have a low suicide rate. So it's just a false association. They didn't even believe their own observations. And this is where science comes in, when you could basically mitigate for your own biases and weed through everything else, including what's here, and see the results clearly. So we just did a quick analysis to restrict it to men, but we saw exactly the same effect in men, according to the researcher. They even found that the longer a person took folic acid, the lower the risk of suicide attempt tended to be. Each month of being prescribed folic acid was associated with an additional 5% decrease in risk of suicide attempt during the 24-month follow-up period of the study. Again, other confounding. It also means looking for things that possibly can corrupt the outcome, to why the result was so dramatic. To proceed. It also occurred to the authors that maybe people who take vitamin supplements in general, as we covered in the beginning, want to improve their health and would thus be less likely to attempt suicide. Makes sense. To address this possibility, they did a similar analysis with another supplement, vitamin B12, as a negative control. But unlike folic acid, there did not seem to be any relationship between B12 and risk of suicide. So that was their negative control. Now, again, as a service to you, I'm going to show you the dosage that they used in the abstract itself. The link is there as well, which you could share with a healthcare professional. Proceed. What they looked at in the study was as follows. I'm only going to give you a brief, we're going to look at a brief amount of information from the abstract itself. The full study requires the subscription, so to say. Proceed. A duration response analysis of 1 milligram dosage revealed a 5% decrease in suicidal events per month of additional treatment. You can read it there. Again, it's information for persons in need to basically share with appropriate services. But now to conclude, if their findings are confirmed in new research, folic acid will be a safe, again, I want to emphasize the word if confirmed, would be a safe, inexpensive, and widely available suicide prevention strategy and potentially help save thousands of lives. You can see part of the dilemma there. It's basically what it comes down to is you have this information that comes out that looks incredibly dramatic, a 44% reduction. Now, in the researcher's aspect, there's a need to bring this information to the public light, but in a responsible manner, meaning they just noticed in the association at this point in time. It may even be a very, very strong association, but causal is what they have to define. Causal meaning if an individual took this with no other confounding factors, nothing else corrupting the outcome, that folic acid will result in this particular dramatic reduction in attempts over time in basically a randomized controlled double-blind placebo study. But it is incredible. And even myself, I was reluctant to even bring the study to your attention and share it with you. Because again, it is such a subject of sensitive nature that you don't want anybody that needs immediate help now basically taken as a prophylactic when they should be seeking professional services. There's a responsibility there. But at the same time too, it's also a responsibility to show it and share with you as well. But I'm grateful that the researchers actually did the detailed work themselves, tried to weed out confounding, and yet still, instead of just sit on it and say, well, this is too good, whatever it is, maybe something must be wrong, we'll just bury it, bring it to your attention as well, or our attention as well. Because now it may motivate other researchers to dive in here and create a null alternative hypothesis and all that other fun stuff that people don't really know what goes on behind the scenes, just because of the personal responsibility and the sensitive nature of the subject. They just want to make sure they do the right thing. We all want to make sure that basically no one is misled and the right path is elucidated. Again, Router Channel signing off. Gratitude to the researchers. Can you imagine this? This one small group, if this pans out to be confirmed, something like this can save tens of thousands of lives? Just like that? That's amazing. Gratitude. Thank you. I humbled you. Watch. I'll catch you all next time. See you then.